Good afternoon and welcome to today's webinar, Addressing HPV Vaccine Hesitancy, Intervening to Increase HPV Vaccine Uptake. My name is Brandy Johns and I'm the Training and Development Manager. Nevada Primary Care Association is a nonprofit organization dedicated to improving access to high-quality, community-based, affordable primary health care in Nevada. We provide training and technical assistance to health centers, community partners, and others to improve access to healthcare for all, especially for underserved and vulnerable populations. For more information, visit us at nvpca.org. This training is in partnership between Nevada Primary Care Association and the American Cancer Society. I want to take a moment to thank them for helping us coordinate this session today. Before we get started, I'd like to go over a few items so you know how to participate in today's event. During the presentation, please be sure to mute your phone or computer so we don't have feedback or background noise. Also, please be sure not to put your phone on hold or we'll hear your hold music. You will have the opportunity to submit your questions to today's presenter by typing your questions into the chat panel. You may send in your questions at any time during the presentation. Questions will be collected and addressed during the Q&A session at the end of today's presentation. Today's session will be recorded and slides will be available to participants. I would now like to introduce today's speaker, Jennifer Cinco. Ms. Cinco is the director of the National HPV Vaccination Roundtable. Her work focuses on HPV vaccine communication and public engagement through social media. She leads the HPV Roundtable work on HPV vaccine communication and public engagement and manages the digital footprint of both the HPV Roundtable and the newly formed HPV Cancer-Free Families Facebook group. Ms. Cinco is interested in using social media to help reinforce the social norm of vaccination, especially in the context of HPV vaccine, and encourages you to join the conversation on Facebook as well. Prior to her work at the National HPV Vaccination Roundtable, Ms. Cinco was the special assistant to the President's Cancer Panel, where she helped research, write, and publish several reports, including and accelerating the HPV vaccine uptake, urgency for action to prevent cancer. Ms. Cinco received her MPH from the George Washington University. Welcome, Jennifer.
Hi, thank you so much for that introduction, Brandy. So as Brandy mentioned, my name is Jennifer Cinco, and I am one of the directors of the National HPV Vaccination Roundtable. And I'm very pleased to be talking to you today about addressing vaccine hesitancy, specifically HPV vaccine hesitancy. At the time of my talk, and I should have plenty of time to respond to questions at the end of my presentation. And these slides will also be made available as well. So to start, I'd like to do a bit of a review of what we know works to increase HPV vaccinations. So psychology offers three general propositions for understanding and intervening to increase uptake where vaccines are available and affordable, such as here in the United States. The first proposition is that interventions can make vaccination easier in a direct way by leveraging but not trying to change what people think and feel. What this means is that these interventions use systems like reminder recall to increase the ease at which parents can bring their children in for vaccination or reduce barriers through logistics and healthy defaults to make it easier for parents to bring their kids in for vaccination. These interventions can also shape behavior through things like incentives or sanctions or requirements. They do not require that the individual, the parent, change a personal belief about vaccination in order to make vaccination easier. These interventions are by far the most plentiful in the literature. We know the most about how these interventions work. The second proposition is that social processes can motivate someone to get vaccinated. So we know that social norms are associated with vaccination, but there is not much research that shows whether these social norms increase vaccination uptake. And finally, we know that personal thoughts and feelings can motivate getting vaccinated. There are hundreds of studies that have shown that risk beliefs and anticipated regret about infectious disease correlate reliably with getting vaccinated, and that low confidence in vaccine effectiveness and concern about safety correlate reliably with not getting vaccinated. What this means is, as a person, if you think that vaccines work and are safe, you are more likely to get vaccinated. And if you think that vaccines don't work and are not safe, you are more likely not to get vaccinated. What might be surprising to know is that there are few randomized trials that have successfully changed what a person thinks and feels about vaccines. And those that have been able to change personal beliefs did not show much effectiveness in increasing uptake. So you might be looking at the title of this talk and wondering, well, what are we doing here then? Why am I telling you this? So even though we are here today to talk about addressing vaccine hesitancy, I want to stress that there are effective interventions that increase vaccine rates without addressing personal thoughts and feelings at all. So if you have limited time, limited resources, or limited capacity, I would encourage you in your practice to focus on interventions that change systems. Thoughts and feelings are important, and I will equip you with some strategies for addressing vaccine hesitancy. But I also just wanted to take a moment to remind you that personal thoughts and feelings are a small, important, but small part of the overall approach to increasing HPV vaccination rates. So before we really begin talking about vaccine hesitancy, I'm curious to know, those of you on the call, what percentage of the parents in your practice, clinic, or office express concern over the HPV vaccine? Less than 5%, a few, close to a quarter or a third, an alarming number. Ideally, many of you will put less than 5% or barely any. But I have a feeling if you're on this webinar, it's because you feel concern over the number of conversations you are having to have around vaccines.
They're up right now. We have 11% said less than 5%, 50% said 5 to 15%, 17% said 15 to 30, and 22% said 30 to 50%.
Oh my goodness. Okay. So, so it sounds like there's definitely a need for some training in how to respond to hesitancy. I'm also interested in your confidence around responding to vaccine hesitancy. It sounds like some of you, or most all of you, are having to, are encountering hesitant parents in your clinic. So how confident are you in your ability to respond? 0 is a confidence, and it's okay to be nervous about this issue. It's also okay to be somewhat confident and just maybe need some pointers and some practice. And hopefully some of you are feeling supremely confident and you're just here for some refinements and some pointers.
So 16% said they have 0 confidence, 68% said I'm somewhat confident, but I can use some more practice, and 16% said I'm super confident, I'm just here for the pointers.
Okay, so it looks like most of you have some confidence. I'm really excited to hear that there are some super confident. I'm actually also really excited to hear that there are people on the call who have 0 confidence, because I do think that this approach that we'll be learning today is one that will help you to do your job. So where does HPV vaccine hesitancy come from? Well, it comes from the place that a lot of vaccine hesitancy comes from. It comes from the internet. It comes from scary stories that people hear in YouTube and someone's cousin's babysitter's niece. We hear these stories in a variety of ways. We know that there has been declining confidence in all vaccines recently, and the HPV vaccine is no exception. Parents seem to have a lot of questions and concerns about the HPV vaccine that they don't have about Tdap or meningococcal vaccines. They might read a scary story on Facebook. The social norm in their community might not strongly be supportive of vaccination. And these parents bring those concerns into the clinic for you and your team to address. So vaccine hesitancy is defined as the reluctance or refusal to be vaccinated or to vaccinate your children. It has been identified by the World Health Organization as one of the top 10 global threats of 2019. So all the way on the left, there's a red box that says refuse all. People who are militantly anti-vaccine are rare. This box is really small. These are people who are just not going to change their mind no matter what you do. They've heard the facts and they just don't care. There's a box all the way on the right that says accept all. The majority of parents in the United States do fall into this box. Vaccination is the norm in this country. However, there is a continuum between refusing all vaccines and accepting all vaccines. And this continuum we call it's the continuum of vaccine acceptance. And this is where your hesitant parents fall. So these are people who are skeptical. They're not total refusers, and they can be swayed to accept, but they might have concerns, they might have questions. These are people who are afraid, but they're not closed off. Something I'll be talking about a lot during our time together today is that the act of asking questions or expressing concern does not equal vaccine refusal. As long as there have been vaccines, people have had questions about vaccines. And it's okay. Despite the overwhelming evidence, despite everything that we know as medical providers to be true about vaccines, parents and patients will still have questions. And that is totally normal. Ideally, your parents will accept vaccines very easily. And if they don't, I'll tell you what you can do. But the first thing, the most important thing that you can do to make vaccination a default decision is to make a strong vaccine recommendation. Pediatricians in particular have some of the greatest influence over whether or not a parent chooses to vaccinate. Nurses are some of the most trusted health professionals of any of the health professionals. Your entire staff can play a role in creating a pro-immunization clinic by expressing strong support for routine vaccination. So how do we make a strong, effective vaccination recommendation? Ideally, many of you have seen this, but if you have not, it is from Noel Brewer's team. And Noel happens to be the director of the National HPV Vaccination Roundtable. So he's come up with what he calls an announcement approach. So before, you might have a conversation about vaccines where you start a conversation by saying, okay, well, today there are 3 vaccines, one of which is the HPV vaccine. Maybe you've heard of it. Do you have any concerns? And you really sort of open the door to a potentially long conversation back and forth about should you get this vaccine, what are the benefits, what are the potential side effects. Ending maybe 20 minutes later, 30 minutes later, in the providing of the vaccine. The announcement approach presumes that the parent will accept. You announce that the child is due for 3 vaccines. You give a bundled recommendation around, you say the Tdap, the HPV, the meningococcal vaccines, and those will be given at the end of the visit. And then you provide the vaccine. If the parent has a concern, you do address it, but you don't assume that there are concerns. So this is called the announcement approach, the presumptive approach, but really this is a specific tactic that has been shown to work. So you can use an announcement approach to increase vaccine uptake. Just the confidence in this approach is oftentimes enough to sway or to assure a parent who might have concerns. The CDC has developed a video series called How I Recommend. And this series highlights clinicians as they explain how they are achieving high HPV vaccination rates and effectively addressing HPV vaccine questions in their practice. So these videos feature not only pediatricians, but family practitioners, nurse practitioners, and they can be found on the CDC website by searching for #HowIRecommend. We also have them linked in the HPV Roundtable resource library, which I'll give you a link to at the end of the talk. So you've made a strong presumptive recommendation for the needed vaccines, and the parent isn't quite ready to vaccinate because they have a question or they have a concern, and they're looking to you for assurance. Some common concerns specific to the HPV vaccine really revolve around, is this necessary and does it work and is it safe? So some of that might look like, if it's so necessary, why isn't it required? Or I have a son, why does he need a cervical cancer vaccine? Is the vaccine safe? Or I heard that this will make my child X, Y, and Z. These really are just kind of different ways of stating three core concerns. And at the center of all of these concerns is sort of this nebulous fear that this vaccine is somehow different than other vaccines and may cause harm. So I would really love to hear from you in the chat box around the best response that you have either used or heard to address vaccine concerns in your clinic. And this is an opportunity for you to learn from one another what's working in your state, but also it's really helpful for me as I go through the transcript to see what's working for you. And I can include those as examples as I give this talk to providers in other states. So throughout the talk, please feel free to share responses that you think work particularly well for your patient population, as that would help me and also help your peers on this call. Before I talk about how to talk to a vaccine hesitant parent, I'd like to touch on how not to talk to a vaccine hesitant parent. So statistics are not effective tools to sway us from emotional thinking. And you can see this in your own life. Imagine you're at the beach, and just before swimming out into the ocean, perhaps with your kids, someone walks up to you and says, "Oh, I wouldn't go in there. There are sharks. Look at this horribly graphic picture of a shark attack victim. Do you want that to happen to you? Do you want that to happen to your kids? If you go in that ocean, it could definitely happen." And then say immediately after that, someone comes along and says to you, "Well, of course there are sharks in the ocean. That's where they live. But like the likelihood or the probability of you being attacked by one is 1 in 11.5 million. Would you be swayed by that? I wouldn't be. I have a visceral fear of sharks, and numbers are not going to change that. When given time and opportunity, we can be rational, but people are not computers, and we don't evaluate risk by examining the relative probabilities of different events. Using a lot of statistics or numbers is not going to make me less afraid of sharks, and it's probably not going to make a parent less afraid of vaccination if they are afraid of it. Another way not to address parents is to dismiss their concerns. The number one thing to remember is that vaccine hesitant parents are not dumb. They have been made afraid by incredibly sophisticated propaganda that is intentionally designed to play on their worst fears. Telling them vaccines are safe and your doctor knows best just shuts down the conversation around a really emotional topic. If you don't answer their questions, they will go to the internet. They will go to their peers looking for answers. And unfortunately, they're highly likely to encounter more myths and more scary stories. Also, beware of your tone when talking to vaccine hesitant parents. Perhaps it's your third conversation about vaccines in an hour. And it's totally normal for you to feel frustrated or worn out, but this is their first conversation with you about it. Judgment shuts down dialogue. And the bottom line is hesitancy comes from a place of fear, and it must be approached accordingly. So what can vaccine hesitant parents hear? Empathy, advice, real stories about the risks of not vaccinating. There's also evidence that pediatricians are more successful when they relate to parents as parents themselves, and to show with empathy that they understand what parents are dealing with. The AAP advises in a 2016 report for pediatricians to have, quote, compassionate dialogues with parents to clear up misconceptions around vaccines, to provide accurate information about the safety and the importance of vaccines, and to strive over time to help parents make the decision to vaccinate their child. So how do we have compassionate dialogue? Well, there are some really easy steps, and the first one is pretty self-explanatory. To have compassionate dialogue, start from a place of compassion. Use very simple facts that address specific concerns or questions. Whenever possible, avoid restating a myth or the rumor. And if it feels good for you, share your personal experience. And then always try and reinforce vaccination as the norm in your clinic, your practice, or your office. This image is from a really great handbook by Lewandowski and colleagues that walks through the science behind this approach for those interested in more details. They developed this handbook for addressing scientific misinformation as a response to the issues that climate change scientists were having when dealing with science denialism around climate change. Many of these tactics work in a variety of different contexts, and I encourage you to seek out this great resource. So I'm going to, over the next couple of slides, give you some specific examples in how I would respond using the framework from the Lewandowski handbook. So if a parent asks, is the vaccine safe? Or some question where the core concern is vaccine safety, I would say, yes, the vaccine is very safe. And then go on to explain how I know that they're safe. All of the vaccines, including this one, are intensely studied to make sure they're safe, even before they are licensed by the FDA. And they're continually monitored for signs that they might cause a problem. And if parents ask about potential side effects, I would encourage you to be honest that, yeah, getting a shot sucks. I mean, every one of us knows shots are not fun. It hurts when you get poked by a sharp object. And it's okay to be honest that not every aspect of the experience is going to be highly enjoyable. You can say, yeah, injections can hurt. And we do know from patients who have gotten these shots that for whatever reason, the HPV vaccine feels like it hurts a little bit more than other kinds of shots. But it is important to get this vaccine, and a little bit of pain now is worth the protection that this shot can give your child over the years. By being honest about the less than desirable aspects of the experience, parents will believe you when you tell them about the benefit of the experience. And always try and end on a really strong statement that vaccination is the norm in your clinic. The parents in our clinic vaccinate to protect their kids from infections that can cause terrible diseases. If you feel comfortable, you can share your personal vaccine story. I vaccinated my kids against HPV. I made sure my nieces and nephews were vaccinated. I really make sure that the children that I love and care about, the children in my life, know and their parents know about this vaccine because it protects from cancer. In this example, the specific concern is efficacy. And instead of saying in really sort of complicated language that the vaccine is extremely efficacious in preventing infection with several high and low risk HPV types, just use simple, natural language. We're all really smart people, and I think that we tend to use language that is familiar to us. But many of our patients did not have continuing education in the sciences. They're not biology majors. They're not doctors. They're not nurses for the most part. So don't use language that is very complicated. Try and remember that the parents are maybe a little afraid and that the simplest messages are the ones that are going to come through the clearest. So I want you to look at the third bullet in this on this slide. Earlier I said to try to avoid misstating or try to avoid restating or repeating the myth or the concern when addressing it. If you have to, there is a way to do this. You prepare the listener, you prepare the parent that what you're about to tell them isn't true. And then it's very important you follow up with a statement that is true that replaces the myth or replaces the lie that they've heard. So in this example, I would say, fair warning, some people might try to trick you into thinking that the vaccine doesn't work. But we know it works, and we know that it works in the body for at least now 13 years without becoming any less effective. And in fact, the vaccine works so well that when given at 11 or 12, your child will only need 2 doses instead of 3. That it works so well that they need 2 doses instead of 3 is extremely effective. Parents know that the dosing has changed and they don't know why often. So when you tell them it's because the vaccine is so effective, it works so well that they actually need fewer shots than we originally thought, that is a powerful counter to the myth that it doesn't work at all. And then again, strongly recommend that the HPV vaccine is cancer prevention in the norm in your clinic. And then this is sort of the most difficult one to respond to because it may not immediately be clear what the core concern is. And it usually comes up in the context of, I heard something really scary. A lot of parental hesitancy can be distilled down to a nameless fear that the vaccine will somehow lead to harm. And this fear may wear many different concerns as a disguise. Perhaps it's first about safety, and then about necessity, and then they tell you about a story they heard, or they want to know about aluminum, or they want to know about the possibility of overloading an immune system. What it all comes down to is that parents want what is best for their children, and it's okay if they have concerns or questions. Everyone in your office should be prepared to respond to these questions the way that they would respond to anyone experiencing fear or misapprehension. Start from a place of compassion. I hear you, I see you, I understand why you are concerned. These questions and concerns are not an attack on your expertise or your knowledge. They are, in fact, the opposite. These parents are asking you because they trust you, because they know how smart you are. Honor that trust with empathy, active listening, and patience. I really like the "I'm so glad you asked me this question" because it builds a bridge and it says, I don't mind that you're asking me questions. I'm here to answer them. And I want you to feel confident and comfortable in coming to me with these concerns. Because as the provider, you know, if they can't get the answers from you, they're going to go to Dr. Google. They're going to type in, does the HPV vaccine cause whatever terrible thing that they think it might cause? And the algorithm is just going to pop up all kinds of craziness that hasn't been validated, that isn't evidence-based, that might just outright be lies. And they're not equipped to be able to go through and discern fact from fiction. The fact that they are offering up these concerns to you means that they're looking for accurate responses and they trust that you're the person to give it to them. So remember, unlike strangers on the internet, you have relationships with these parents. They know you and they trust you, or they wouldn't be in your practice. They wouldn't be asking you these questions. When you encounter vaccine hesitancy, just remember that concerns do not equal anti-vaccination beliefs. Questions are okay, and your patients are looking to you for guidance. So you've made vaccination the norm in your clinic. You've set up all the systems to facilitate action and reduce barriers. You've given a great, strong, presumptive recommendation. You've answered their questions and concern with empathy, simple, straightforward facts. You've made it clear that vaccination is the norm in your clinic and the parent still refuses. I'm here to tell you that it's okay. Most parents choose vaccination eventually. If they decline in one visit, it does not mean that they will decline in the next. And I encourage you to keep trying at every office visit, both routine and acute. Keep sending them to trusted online resources. Keep giving them reminders. Keep giving them the pamphlets. Keep giving them answers. Try again. And unlike in school, it is okay to copy your neighbor. You don't have to come up with all the answers on how to do this on your own. Several organizations, including the Centers for Disease Control, the American Cancer Society, American Academy of Pediatrics, and others, have created resources to help you make strong vaccine recommendations and respond to HPV vaccine concerns. what's really great is because you know your parents and your patients, you can kind of suss out. Perhaps this is someone who isn't going to necessarily buy into a .gov website. They think maybe the CDC isn't on the up and up. That's okay. You can send them to the American Cancer Society. You can send them to the American Academy of Pediatrics. If they don't think that, if those don't meet their needs, perhaps you could send them to St. Jude's. There are resources that sort of meet everyone where they're at. And as you go through the resource library, or as you're looking through partner resources, such as those on the slide, you'll sort of begin to get a feel for what's going to appeal to your particular patient population. The two links on the bottom of the slide, one goes to the resource library on the roundtable.org website, and it's pre-filtered to pull up things that are appropriate for parents. So if you're looking for materials to hand to the parents in your clinic, if you're looking for materials to help you feel more confident in how you talk to parents, this is a great link for that. The other link goes to the CDC's website and will take you directly to a page full of resources for helping clinicians to respond to parental questions in the clinic. So from there, you can launch into a lot of different resources, or if you have trouble finding exactly what you need, please feel free to reach out to me and I'll get you pointed in the right direction. So as a summary, when responding to vaccine hesitancy, just remember compassion. Start with compassion, not judgment. Parents are scared, they want to do what's right, and they're looking to you for guidance. Use simple facts that address specific concerns or questions. Avoid restating the myth or reinforcing the rumor. When it feels appropriate, share your personal stories and reinforce vaccination as the norm in your clinic, practice, or office. So I hope that over this time together, you've learned some tricks and tools that will make you feel more confident in your ability to respond to vaccine hesitancy. If you haven't, that's okay. I would really love to know what sorts of questions you might like to see answered on the slides, what specific resources might be useful, because I can go to our partners and we can see if we can get those developed for you. So Brandy, I don't know if you want to open the slide. Thank you. Open the poll. But ideally, you do feel more confident, but if you don't, please let me know. I'd love to know why, so that I can make this training better and make sure that we have resources that meet your needs. It's important because as providers, you are superheroes. You have the power to prevent HPV cancers. And I hope that today's webinar helps you feel more confident in addressing HPV vaccine hesitancy. Parents look to you as a trusted source of information, and their experience with you in the clinic means more to them than a story that they hear about on Facebook or something that they might read about or hear about from a peer. So please know that you are the most important part of this process. And I really hope that this webinar helps support you in the goal of getting more kids vaccinated.
Yes, they learned what they needed to know. We have 24% said somewhat. I learned some new things, and 0% said not really.
Awesome. Thank you, everyone. That makes me really happy, both as a presenter and as an educator. So I am happy to answer questions, and I will open up this so that I can see the chat box.
And if you have any questions, if you could raise your hand, I'll go ahead and unmute you if you don't want to type it in, or you can type it into the chat box.
Yeah, and so many of you probably know, in the news lately, there's been a lot written about the outbreaks of measles here in the United States and around the world. And I think in part, we're starting to see more people speak publicly about the dangers of vaccine hesitance, about the dangers of not vaccinating. And so what that does is it really gives you sort of an umbrella cover to talk about that more openly in your clinic. I think that it's really okay to say, to talk about the dangers of not vaccinating in a real way. If you have HPV cancer survivors in your communities who would be willing to talk and tell their story, survivor stories are really, really powerful. People don't realize what a difficult cancer cervical cancer is, not only to treat, but and not only for the person experiencing the cancer, but for their families and for their loved ones. This is a cancer that can affect women who are still in their childbearing years or who have young kids at home. It's not something that just is super easy to treat as an outpatient procedure. It's involved and it's scary, and people do die from cervical cancer. Head and neck cancers also are terribly traumatic for the people who get these cancers. So telling parents that this vaccination can prevent their kids from experiencing these traumatic, sometimes debilitating, sometimes fatal cancers is an appropriate response. You're not fear-mongering. You're not trying to tell them a scary story just to scare them. You're sharing the realities of what HPV infection can lead to.
I do not see any questions. I see a lot of compliments, and everyone said it's been very helpful, but I'm not.
We've got one question in the chat box. Can you hear me okay?
Yeah.
Awesome. So Wilson Chin is asking you, how do you answer parents who say their sons do not need the HPV vaccine?
That's a great question. So, right, so boys don't get cervical cancer because it's a cancer of the cervix, and the HPV vaccine for a long time was marketed specifically to girls. However, HPV infection can cause cancer of the head and neck called oropharyngeal cancers. And the incidence of oropharyngeal cancers is actually higher in men than it is in women. More men will be diagnosed with HPV-related oral cancers than women will be diagnosed with HPV cervical cancers. And part of that is we have screening for girls. We don't have screening for boys. Something in a line, and this is really dependent on the parent that you're talking to, but HPV also causes cancer of the penis. And so when you say, well, you're right, your son doesn't have a cervix, but he does have a penis, and he could get cancer there from HPV, and we don't have screening tests. We have no early warning systems for these kinds of cancers. So better to vaccinate your son and protect him from cancer of the penis, cancer of the head and throat, protect his future female partners should he have them, than to say, well, it's not necessary now and to forego this. Well, I know it's lunchtime for many of you, so I am always available. My email is here on the slide. These slides will be available as well. So if you have questions or specific things come up in the clinic and you're like, I just really didn't know how to respond to this, please reach out to me. This is what I do for my job. I talk to people about how to talk about HPV vaccination. And so you are doing me a favor by educating me about what you're hearing in the clinic, and hopefully I can provide you with some tools, even specific language that you might find helpful in doing your job. So, June and Brandy, thank you so much for having me today.
Thank you, Jennifer. And thank you to everyone for attending today's webinar. If you have any further questions, please contact me at bjohns@nvpca.org, or Jennifer's contact information is up on the screen. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate if you'd complete that and provide your feedback. On behalf of Nevada Primary Care Association, thank you for joining us today, and have a great rest of your day.